Today's session, ACING OET last moment writing preparation tips, especially for the candidates of the 19 December examination. We're going to do a brief review of some of the uh, things that you should keep in mind while you are writing a letter in the OET exam. So let's start. Uh, okay, we all know the criteria of marking in the OET exam for the OET writing. There is total 38 marks of all the criterias, and to get a grade B you need 27 out of the 38. So we are starting from the first thing, that is the purpose. The purpose of the letter should be immediately apparent. You know this. This is the purpose. How to write a purpose? You know how to write the purpose. It is uh, the patient's name, social diagnosis or final diagnosis of the main symptom, is to tell whether there is a regular or urgent case, and if there is any additional request you have to put into the purpose portion. Like here it's an example of purpose that I am writing to refer Mr. A, 34-year-old businessman. This is the patient's name in each part. Then partial diagnosis part, who has symptoms suggestive of acute myocardial infarction. uh, then the regular urgent part, the case part, is that your urgent enhancement is the urgent enhancement, and management would be greatly appreciated. So this is in brief about purpose. So in the purpose you need the patient's name, age, partial diagnosis or final diagnosis of the main symptom depending on what is given in the case, or there is a regular urgent case, and if there is any additional request you have to put inside your letter in the purpose part. Okay. Part letter should contain all the relevant information and appropriateness should be present. In order to choose the relevant information and maintain appropriateness, before choosing any information you have to ask yourself three questions: whether the information that you are choosing is appropriate to continue the care for the patient, who you are writing to, and the final diagnosis. When you ask yourself these three questions before choosing any information, then it will be easier for you to select the relevant information. For example, if patient comes to you whose diagnosis is diabetes mellitus, and you're writing a referral to an endocrinologist, and in the case note is given that the patient's father has history of myocardial infarction, his sister has history of diabetes mellitus, and his mother has history of depression. In that case, the mother's history of depression should be omitted because it has no role in maintaining the care that should be given to the patient. And I'm referring to an endocrinologist who has no business mm, about by knowing the history of depression, and the final diagnosis of diabetes mellitus has nothing to do with the mother's history of depression, so we omit this part. Okay. Then the um, consciousness and clarity part. To maintain consciousness and clarity, all irrelevant informations will have to be omitted. The tense should be uh, perfect or written correctly. That is how you maintain the clarity, and you have to do proper summarization of the information. We have discussed a lot about this in our OET writing course classes. Okay, so these are three things: that all irrelevant information should be omitted, the information should be presented clearly, it means the tense should be right, and summarization should be done properly. Part, these are some of the portions that you have to keep in mind, that the letter should be non-judgmental. Abbreviations can be used except the disease name and investigation name. Only formal words are allowed. No formal words are allowed. No word contraction or short form should be written, and no symbol or exclamation mark is allowed. Okay, these are things about genre and style. We have discussed about it already. There are some informal words that is commonly used in the letters which should be avoided. They are moreover, furthermore, but, because, also, ago, about, come, so, as, though, although. These are some of the informal words which should be avoided in a formal letter. And also, word contractions like can't, won't, I'll, first, these are not allowed. You'll have to write the full form of words. Then organization and layout part, that is how to organize. This is a very important thing. There are usually four types of para in an OET letter. What is the introduction para, which we have already discussed about? There is a conclusion para, which is almost common for every letter, and there are two other types of paras. One is of about the personal history of the patient, and one is about describing the visits. So when you are organizing personal history, you start from the most relevant information and end with the least relevant information. Personal history usually consists of the past medical history, family history, smoking and drinking history, drug history, and allergy history. You start from the most relevant information and end with the least relevant information in a paragraph. That's how you organize a personal history para. And how to organize a visit para? You all know how to organize this. You start from the chief complaints of the patient, followed by the examination findings, then the investigation findings, and followed by the management advice and referral. Okay, let's move on. Last part is the language part. There are some things you have to keep in mind. That is, you have to prefer passive tone. Active tone should be avoided. You have to use connectors, but do not overuse them. Like, do not use more than 6 to 7 connectors in a whole letter. Maybe 1 or 2 connectors in each paragraph. Spelling should be right. Vocabulary should be right. You do not have to use catchy vocabulary. Simple vocabulary is good enough to clear the OET writing. And tense should be correct. Okay, so I think these are some of the vital points that you should keep in mind before attending the OT writing, and I hope that all of you do a very good uh, result and at least get a grade B in your writing. Thank you very much for attending today's session.